Hey doctors, welcome to the very first video of our Williams Obstetrics Bite-Sized for Busy Residents series. I know how it feels to want to read, but your 36-hour duty says otherwise. So here's a small gift, short, digestible videos you can listen to in the metro or between rounds. Before you even open chapter 1, let's go over some key definitions. The foundation of obstetrics terminology. These are standardized by bodies like WHO, ACOG, and AAP. And yes, you'll see them in MCQs, logbooks, and even clinical audits. Perinatal period is the interval between the birth of a neonate born after 20 weeks gestation and the 28 completed days after that birth. When perinatal rates are based on birth weight rather than gestational age, recommendations define the perinatal period as commencing at the birth of a 500-gram neonate. Birth, complete expulsion of fetus after 20 weeks. If the fetus is under 500 grams and poorly dated, it's recorded as an abortus. Birth rate, number of live births per 1,000 population. Fertility rate, live births per 1,000 women aged 15 to 44. Live birth, any baby who breathes or shows signs of life. Stillbirth or fetal death, no signs of life at birth. Early neonatal death is defined as death of a live-born neonate during the first 7 days after birth. Late neonatal death is defined as death after 7 days but before 29 days. Infant death, all deaths of live-born infants from birth through 12 months of age. Stillbirth rate or fetal death rate, the number of stillborn neonates per 1,000 neonates born, including live births and stillbirths. Perinatal mortality rate, the number of stillbirths plus neonatal deaths per 1,000 total births. When we talk about perinatal death, there isn't just one definition, and that's important to understand, especially in global or epidemiological contexts. There are actually 3 commonly used definitions, and they differ based on how early in gestation the fetal deaths are counted and how long after birth infant deaths are included. Definition 1. This one is used by the World Health Organization and for international comparisons. It includes fetal deaths at 28 weeks or more and infant deaths within the first 7 days of life. This one is more inclusive, covering the entire perinatal spectrum. It includes fetal deaths at 20 weeks or more and infant deaths within the first 28 days. A third variation includes fetal deaths at 20 weeks or more and infant deaths within the first 7 days. This is a middle ground approach. Key point to remember: the NCHS, that's the National Center for Health Statistics, uses both definition 1 and 2 depending on the purpose. But when comparing data between countries, definition 1 is preferred because not all countries consistently register fetal deaths between 20 and 27 weeks. Still, for monitoring perinatal death across the full gestational spectrum, definition 2 gives the most complete picture. So next time you see perinatal mortality stats, check which definition is being used. It can make a big difference in interpretation. Neonatal mortality rate, the number of neonatal deaths per 1,000 live births. Infant mortality rate, the number of infant deaths per 1,000 live births. That's it for part 1 of essential definitions in obstetrics. In the next video, we'll cover the remaining key terms, including abortion, maternal mortality, and pregnancy-related classifications.